Alright, welcome back everybody to another video. This week we're going to be playing around with light therapy on Josh. So what light therapy is, it's a physical agent used in the clinic for multitude of reasons. Today we're going to look at pain management for his quad. This is a chronic injury. Some of the effects of light therapy include soft tissue healing. It increases muscle metabolism through the synthesis of ATP. It also promotes vasodilation through the release of nitric oxide, or it can alter nerve conduction and increase nerve regeneration if there's any damage to the nerves supplying the muscle. So some contraindications to this kind of therapy include direct radiation to the eyes, which is why we're going to use protective goggles later on. Malignancy of any type, radiation therapy within the last 4 to 6 months. You also don't want to apply it over any hemorrhages, the thyroid gland, or other endocrine glands. And then some precautions include if your patient is pregnant. If you're using this on a child who's still growing, you don't want to put it over the epiphyseal plates. Or also if you're working with a patient with impaired sensation, mentation, or increased photosensitization of their eyes. So some general parameters for light therapy. These probe heads, they come with LED, SLD, or laser light bulbs or diodes in them. So depending on the type of, the depth of the tissue that you're targeting, you can use LED for more superficial or diffuse areas, SLD somewhere in between from superficial to moderately deep, and then laser penetrates the deepest, but it's also the most concentrated. These lights use wavelength from red, which is 600 to 700 nanometers, or infrared, which is 700 to 1100 nanometers in length. And the power will range anywhere from 1 to 5 for LED, all the way up to 500 megawatts for laser. So when applying this, we're going to want to rub down the area that we're going to be treating to remove any chemicals, lotion, or anything else that might be on the surface. And then we'll instruct the patient to put on their protective goggles. And then when you turn on the machine, you can select the power, and this is in the form of energy density, which is measured in joules per centimeter squared. For a chronic injury, you're going to want to set that anywhere from 10 to 20 joules per centimeter squared. And you'll increase the dosage, so if the patient's coming back in subsequent sessions, then you can go anywhere from 10 to 15 to 20. But for this first session, we would use 10. And then you'll apply it to the area, and you're going to hold this here. Check in with the patient as needed. Since you'll be here, you probably just have a casual conversation with them. Check the area, make sure they're not having any adverse reactions. So other kinds of therapy that you could also use in place of light therapy, again, will depend on the depth of the tissue. So if it's more superficial, you could use something like a hot pack, paraffin, or fluidotherapy. And if it's deeper, you can opt for ultrasound or diathermy.